Hi everyone, my name is Lathika Pai and I lead Project Amplify, a joint program with Accenture and Microsoft to engage with startups who are really focused on social impact and in the areas of sustainability. With us today, we have Dave Newman, who is the founder and CEO of PlanCare. Dave is based in Perth, in Australia, and is really working on a very challenging area in terms of assisting people with disabilities to leverage the support given by the Australian government. Dave, welcome, and it would be great to know why you started PlanCare.
No, thank you. Firstly, thank you for having me on here. It's great to be part of the Project Amplify project. The reason we started PlanCare was we simply, like many other founders, we saw a gap in the market. For the last sort of 3.5, 4 years, myself and some of my colleagues have been consulting to both disability providers, the government, aged care providers, and we just saw a gap in the market where we would enable people who receive government fundings or want to receive in-home care to be essentially to self-manage their care. So that means taking control of their financing, their budgets, the money they get given from the government, all the way through to coordinating the workers and the providers that come in and provide them the supports and care they need. Through to the rostering, and basically bring that all together into one platform and using technology to enable us to deliver that service at a lot lower cost than what's traditionally out there in the marketplace today. So we've been at it now for just over a year. So we started in January 2021. It's been a phenomenal year and we're looking forward to an amazing 2022.
No, that's fantastic. Like from what I've understood, it's not a simple process at all. And being, for citizens to be able to leverage the funding given to them by the government in an effective manner is something extremely important. What have some of the challenges been in terms of having the PlanCare platform being adopted both by, the patients/citizens and providers?
Yeah, that's a good question. So I think I'll break it down into challenges anyway. With anything when you're dealing with government funding, there's always lots of legislation, regulation, rules to be adhered to, laws to be adhered to. And so for the first quest for us to essentially was to jump through those hoops so that we can get registered on all the different categories that we want to provide services for. We have to go through and register it because we wanted to do it right for the first time. The second part of that is that some of the complexities in simplifying what is a very complex industry, and we had a previous meeting prior to this, and then we tried to explain to someone who's new to it. What we're trying to do is really take some of that complexity out. So when people come into this industry, if we look at the disability market, nobody is born, wants to be born with a disability or unfortunately gains a disability through their life. But when that does happen, it's what happens next, and how do you overcome that? And when that does happen, it's very overwhelming. So one of our missions is to essentially use technology to help simplify that process, to take them through that journey, to give them the information. And that's not just in giving them the technology platform to interact with, but it's also giving them the content within that platform so that they can start to learn. So one thing that we've been core at is, if I look at the disability sector that we're working in, is to make sure that all of the content that's within our platform is in what we class as an easy read format, and in formats that they can understand, they can read, watch, listen to. And so one of the bits was to find the right technology bits that was right for the person and have that flexibility in which they choose. So that's been probably one of the biggest challenges. I think if I look at the other aspect of it, is essentially what we're trying to do is connect the two ends of the spectrum. So from consumers that receive this funding through to us servicing them and being the custodians and the management of that financial aspect of their budgets, through to the network of providers that we work with and have on our systems, is creating that platform that is seamless from end to end, so that making sure that, whilst I hate the term and I hate calling us a marketplace, It's about simplifying in a way that the users, it makes sense to a business to consumer end here, and somebody who's one in their later part of life, so they're over 65, and to someone who may, potentially have a non-physical or mental disability where they cannot, they need to take a little bit more time to understand what it is that we're delivering to them, through to then the business side of things, which is the business aspect. So again, just simplifying that and creating it in a language that everybody understands has been very difficult. One that I think we do very well though here.
Right. And what do you see as the opportunity? How many patients today could really leverage the platform that you have?
Oh, I guess anybody that's over 65 that wants to live longer at home. I think that's, if I look at that market specifically, it's a huge market globally. If you look at one of the biggest issues that a lot of governments and countries are worrying about is population decline. That is essentially people are, we're going to have a lot larger, older demographic in years to come, and we're not producing enough children to kind of come up and help and look after those roles. So in that instance, that is where technology really kind of needs to be leveraged to kind of help automate a lot of those manual processes. AI needs to be used in helping kind of create that conduit, maybe that communication conduit with people, yeah, essentially that's one of the areas that we're focusing on.
Right. And do you, my last question to you, Dave, is do you see the platform, once you've scaled in Australia, being a platform that could be used, globally? Because like you mentioned, you're absolutely right. Countries like Europe have a very, very large aging population with governments that are supporting their older citizens. So do you see PlanCare being, able to scale and be made available across geographies?
Yeah, so let's go back to the previous question. There's just under 500,000 people in Australia alone that's got a disability. And I think that's going to grow because I think the way that we diagnose a disability is becoming a lot clearer with the technology, the medical advances that are happening. If I look at the aged care space, specifically in the aged care, obviously the demographics, it's I think there's a 30% of Australia's population is over 65, of which 175,000 here in Australia will claim funding of the government to help them with supports at home. The social system that we have here in Australia is very similar to that in the UK, many European countries, New Zealand. And so whilst the industry here in Australia is worth just over $42 billion alone, the global market is even bigger. It runs into the trillions and trillions of dollars. So absolutely, I mean, whilst we can be a very successful company here in Australia, we do have our sights set on going north and going east and north, and also not withholding the European, the Asian markets as well. But with that, we recognise obviously there's comes like language barriers and that, but we do recognise our business model can be used in those particular countries, because ultimately we're giving you the tools and the systems to manage your loved ones. If you've got a loved one, your mum, your dad, your aunt, your uncle, whoever, it's very difficult if you are then the carer for them. So how do you manage that all in one place so that you can have more hours of physical care for them and not be paying these fees? And that's kind of where we come in. We allow you to bring that all together into one place and to coordinate it. So yeah, absolutely, we've got global ambitions. But at the moment, I'm a big believer, if I can't do it here in Perth successfully, it's going to be harder for me to export it to Sydney, Melbourne, the rest of Australia before I go to like London and New Zealand, etc.
I think you're right. I think you have enough of a opportunity in Australia, and but I'm sure if I were to fast forward the next 3 to 5 years, I can see PlanCare being adopted globally. All the very best to you, Dave. We're here as a part of Project Amplify, as Microsoft and Accenture, to help you in your journey, to help you adopt technology and scale. And good luck.
Thank you very much. Appreciate you taking the time. Cheers. Have fun.
Thanks. Cheers. Bye.